We're going to go to Hailey Bieber, who's revealing she suffers from a skin condition called perioral dermatitis. We're going to talk live with dermatologist Dr. Whitney Bowe about it in just a moment. But first, Mona Kosar-Abdi has more on Hailey's story.
Supermodel Hailey Bieber opening up to her fans about her skincare journey and the condition she says she's been struggling with for years. The 24-year-old taking to social media, sharing a photo of her cheek and writing, quote, "Since I like to be as transparent as possible about my skin, I have something called perioral dermatitis." Perioral dermatitis is an inflammatory facial rash that affects people across all ages, races, and ethnicities, but mainly is seen in adult women. Roughly 90% of those affected are women between 18 to 50 years old. The condition usually appears as a scaly or red bumpy rash around the mouth that may spread up to the nose or eyes. The rash may burn or itch and can resemble acne. Bieber revealing her diagnosis to her nearly 31 million followers and warning her fans about what triggers her flare-ups, including, quote, trying a new product, a product that's too harsh, weather, masks, and sometimes certain SPF. And one of the biggest culprits for breakouts? Laundry detergent. Bieber writing she has to use hypoallergenic organic laundry detergent always. Throughout the pandemic, the star joining Dr. Barbara Sturm in virtual skin school conversations, sharing what she's learned about getting and keeping her skin healthy.
If you are treating your skin and you think that it's been a month, 2 months, 3 months, and you don't really feel like there's an improvement, to me, that means that it's a deeper issue than just skin itself.
For Good Morning America, Mona Kosar-Abdi, ABC News, New York.
Joining us now with more is board-certified dermatologist Dr. Whitney Bowe. Doc, thank you so much for joining us this morning. And how common is this condition, and what exactly causes it?
So perioral dermatitis are these tiny red bumps. They mostly appear around the mouth, but Michael, we do see them right around the nostrils, right around the eyelids as well. It's actually fairly common among women. And things that can increase your risk are the use of any kind of a cream with a steroid in it on your face, or even a nose spray or an inhaler with a steroid in it, but also the use of any kind of an ointment like Vaseline or Aquaphor on the face because of the ingredient petrolatum.
And what about masks? Because everyone has to wear masks now when they're out and about. Can they cause this condition?
Yes, I'm definitely seeing an uptick in this condition during the pandemic, and I do think that masks are at play here. Specifically, the combination of masks plus makeup. So in my patients who are dealing with this, I'm telling them to try to switch off of their foundation. Just use a lightweight moisturizer instead. That can be very helpful.
And we know Hailey says she's been using gentle anti-inflammatory and hypoallergenic products. But when it comes to treatment, what exactly do you recommend?
You want to try to avoid cosmetics, especially foundation, as much as possible. You want to try to avoid skincare with fragrance, especially essential oils. This is a case where natural and organic is actually not better for the skin. And then also you kind of want to see a dermatologist for this, Michael. You want to make sure, first of all, you're dealing with the right diagnosis, right? And also sometimes you do need a prescription for this.
All right, Doc, thank you, as always, for all the insightful information that's going to help a lot of people who are going through this right now. So thank you so much, Dr. Bowe.